Hello viewers, I am Dr. Sriram. I am a consultant rheumatologist at KS Hospital practicing in Chennai, and I am going to give you an overview of rheumatoid arthritis, which is the commonest arthritis occurring in rheumatology practice. So it accounts for about 0.5 to 1% of the population. The people may be worried about what happens in rheumatoid arthritis. So I will be explaining in a few minutes about the occurrence, etiology, that means the causative agents, and what happens exactly in rheumatoid arthritis. So rheumatoid arthritis is a chronic systemic autoimmune disease which can affect joints and outside the joints. So the primary target in rheumatoid arthritis is called the synovium, which is the covering of the joint. Apart from joint, all other structures can also be involved. For example, tendon, ligaments, cartilage, bone, and even the extra articular, that means outside the joint, including eyes, heart, lungs, and even in late stages it can involve the kidneys and nerves. It can also cause a neuropathy. So coming to etiology, it is mostly a genetic disease. You have to have a gene, that is a susceptible gene, to have a disease. If you don't have the gene, the probability of developing the disease is low. So the gene involved is called HLA. If you have a HLA gene and you have some habits like smoking or an infection, can trigger the disease. So there are two hits. First hit is the genetic hit, and second hit is the environmental factor, which includes infections and smoking. So smoking is the commonest environmental factor that can cause rheumatoid arthritis. So when these things happen, there is a term called citrullination, where you have abnormal proteins expression in the body. So these proteins are taken as foreign, and body tries to produce antibodies against them. These antibodies are only detected in the blood as rheumatoid factor and anti-cyclic citrullinated peptide antibodies. So these are the substances which are measured in the body to diagnose rheumatoid arthritis. So a person with rheumatoid arthritis will present with long duration of pain and stiffness involving the joints, predominantly small joints of the hand and foot, along with large joints also. So a person who presents with swelling, tenderness, so the tenderness is the pain while palpation, that means when you touch he has pain. So when a patient presents with pain, swelling and tenderness of the small and large joints of the hands, which is present for more than 6 weeks, there is a high probability that the patient has got rheumatoid arthritis. So who gets this disease? It is primarily a disease of females, that is between 40 to 60 years of age, and there can be a substantial population more than 60 years, that is called as late onset rheumatoid arthritis, which has mildly different features than that of a person who gets a rheumatoid at 40 to 60 years of age. So this person can get a swelling of the joints along with some other features like eye involvement in the form of red eyes, or a heart involvement, or a neuropathy, or some other extra articular manifestations like rheumatoid nodules, which are swellings occurring in the body. So these are all late manifestations of rheumatoid arthritis. So again, when a person has developed this, you have to consult a rheumatologist. Rheumatologist is the specialist who is diagnosing and treating this rheumatoid arthritis. So we commonly diagnose this with two antibodies, that is rheumatoid factor and anti-CCP antibodies. These are the available investigations which are available in the market, and we can assess the disease activity using inflammatory markers like ESR, erythrocyte sedimentation rate, and C-reactive protein. These are the markers for inflammation. Once you have diagnosed rheumatoid arthritis, then you move into the treatment. Treatment consists of two parts. Initial part, you start the patient on steroids, and then when as a steroid sparing agent, you start them on medicines called as disease modifying agents. So these disease modifying agents can modify the disease activity, so that when the patient has high disease activity, and when you start these drugs, they come into low disease activity, and then if they don't respond to these drugs, the disease modifying drugs, you have latest medicines called as biologicals. Biologicals, you have many biologicals in the pipeline, almost there will be around 10 to 15 biologicals which can be used according to the patient clinical situation. So there are latest advances in the management of rheumatoid arthritis. So how will I progress in rheumatoid arthritis? This is a common question occurring in patients. So, when a patient takes regular medicines in the form of disease modifying drugs or biologicals, the prognosis is usually very good and they come into remission with either of these drugs. And how long to continue this medicine? This is a common question asked by people. Almost this doesn't have answer. You have to continue the medicines indefinitely. So when a patient takes this medicines, he can come into remission. Remission means completely into a normal. So you have disease activity parameters, which is called as DAS28, disease activity scoring, with which we monitor your prognosis. You can monitor prognosis using patient means, because we can ask you for pain, swelling and tenderness, and also using inflammatory markers like ESR, CRP, and also using disease parameters like disease activity scoring. So this is the overall view about rheumatoid arthritis, and have a good day. Thank you.